Assalamu alaikum warahmatullahi ta'ala wabarakatuh. My name is Hussein Abdul Salam. I am a consultant physician of internal medicine, respiratory medicine in Petrus and USF Hospital in Germany. I tried today in a small talk to illustrate a very important topic in medicine. Nowadays, we are involved directly or indirectly in the vaccination campaign in order to prevent the occurrence of COVID-19 in our citizens in Libya. That's why I try to choose this topic, anaphylaxis, in order to illustrate some points for the junior doctors in Libya. So I will talk now about the diagnosis, and the next days I'll try to illustrate the treatment. So the diagnosis of anaphylaxis can be made according to one of the three criteria. If you get criteria number 1, you get the diagnosis. Criteria number 2, also you get a diagnosis. Criteria number 3 is the diagnosis. To illustrate it so quickly and to illustrate it in a way that you are not going to forget, I hope, in the future, then I will consider that I did a really good job and helped my colleagues, junior colleagues in Libya. So the criterion number one is the development of an acute illness with skin and mucosal manifestations within minutes to hours. So within minutes to hours, your patient develop an acute illness with skin and mucosal manifestations with one of the two next points, with respiratory compromise or hypertension. Now I will illustrate every point I said. Acute illness with the development of skin and mucosal manifestations. Skin manifestations include hives, pruritus, flushing, and mucosal manifestations include lip swelling, uvula swelling, tongue swelling, lid swelling. Okay, then respiratory compromise include dyspnea, hypoxia, stridor, wheeze, rhonchi, and hypertension. I mean, either you get a systolic blood pressure value less than 90 millimeter mercury, or you get a drop of 30% of the systolic value compared with the baseline of your patient. Or you get symptoms of tissue malperfusion like syncope, collapse, incontinence. There are also symptoms of tissue malperfusion or hypoperfusion, which may result if the blood pressure drop significantly. So blood pressure measurement in children is a little bit different. So if you got a systolic blood pressure less than 70 millimeter mercury in a child between 1 month and 1 year, that's an infant, then you got an hypotension. If a child is aged between 1 year and 10 years, then you have to multiply the age by 2 and add 70 millimeter mercury. So if the child is 7 years, then you multiply 7 by 2 is 14 plus 70 millimeter mercury, then you get 48. So if the measured systolic blood pressure value is less than 48, then you get an hypotension. So that's the criteria number 1. The criteria number 2, if you get 2 or more of 4 points. Respiratory compromise, as I said before, hypotension or signs of tissue malperfusion. If you get abdominal symptoms like abdominal or crampy abdominal pains, like emesis. If you get skin manifestations. So skin manifestations, respiratory compromise, hypertension, and abdominal symptoms. like nausea and emesis, crampy abdominal pains. And if you get 2 of the 4, you get a diagnosis. Only in case of an unlikely allergen. So if you have an unlikely allergy to a substance, and you get 2 of 3, or get the 3, or get 2 of the 4, or get the 3 or the 4, then you get the diagnosis. If you have a known allergy to a substance like peanut, and you ate it and you developed in hypotension, early in hypotension, with the criteria I mentioned before, then you have the third criteria, which is an exposure to a known allergen plus the development of hypotension. Then it's an anaphylaxis, and you don't have to wait for the development of the skin and mucosal manifestations, respiratory compromise, so crampy abdominal pains with nausea and vomiting. So you have already get the diagnosis. I hope I have illustrated such points, such an important topic with so a small talk. Thank you very much for watching, and till the next time. Assalamu alaikum warahmatullahi wabarakatuh.